Okay, so I think we are live now on Facebook. Hey, everybody, I am Kim Martin, founder of I've Decided, and I am at Whitecast Studio. And when technology gets a little wonky, well, we figure it out. That's what we do. So we are bringing my success to you today live on Zoom. We're on Zoom live on Facebook. How cool is that? And and that's what we're doing today for our show, My Success. So here we are, and I'm excited for today's show because my guest today is Colleen McMahon from the McMahon Group. Hey, Colleen.
Hello.
How's it going?
It is great. Great.
Thanks for your
People for technology.
Well, we're trying to be safe and social distance and do this live stuff without having to come into too close of contact with each other. And so we have options. And of course, Tim Johnson at Whitecast Studio is awesome, and he's trying to help us. But when you have technology glitches, there's not much you can do about it. So you figure it out. And this was the best way that we could find a solution, the simple solution on Zoom today. And if it's all working well, we are live on Facebook. And Colleen, it's funny because the tagline that I have for this Facebook Live is I've decided to change healthcare.
Yes.
And I said, it sounds like a big task, but our guest today, you have decided to do just that. And I've known you now for a couple of years, and you are very passionate about healthcare. And I fully support and believe in everything that you're doing. And I believe that there is a solution to our healthcare crisis. And it is a crisis that we're in. And I think what you support and what you share is a solution, and really probably one of the only solutions that's available. And so our weekly winning word this week is disposition. And learned a lot about disposition, and mainly, it's like any kind of behavior. We can control our disposition. We can practice and change our behaviors and choose to have a different disposition. And I know what you run into in the healthcare world is that people, it's hard to have an open-minded disposition, if you will, because it's hard, and especially when it comes to something as big as healthcare. So I'm going to give you the floor here for a little while, and help us understand why we're in a healthcare crisis, a little bit about how you think we got here, maybe, and what your solution is for helping us get out of this, and what do we need to overcome? What disposition do we need to have in order to be open to learning and trying something new that could really change our industry, that change the way we're doing things?
Sure. Well, you couldn't be more spot on about the disposition perspective with regards to healthcare. Everyone feels that the topic is so overwhelming and so large that they just couldn't possibly individually make a difference or have any choice or freedom. So they continue to do what they're doing. And in reality, it's really not that big a deal. And I know that seems crazy, but it isn't. What is healthcare? Healthcare is, you have a personal need and you seek a physician who's trained, that you have a trusted relationship with, to help you with that care. It's not any different than going to your mechanic. It's that simple. You have an issue, you find the doctor in your community that you like, he has a price that you agree on, and you trade services. And the problem is we've let so many additional people in the room with the patient and the doctor, and all of them are adding layers of complexity and cost. And so I know that seems, incredibly oversimplified, but that really is what it boils down to. We as consumers, patients, we need to have the opportunity and access to simply decide what's best for us, what provider we want to go to, and we have that choice on who we think is valuable. Just like some people, drive a jalopy and other people want a brand new Mercedes. That's their choice on what they think is valuable. And I don't mean to say that, care is, we still want all of those organizations managing and overseeing the quality and education of the physicians. We still want very, very high outcomes. So I don't mean to draw any reference to lesser care, but whether your doctor, many of us may have grown up in a small town where, the doctor performed services in his home. That's where your primary care doctor was. If that's okay with you, then that's what you decide is value. If it's important to you to go to a doctor that's in an atrium-filled building with fountains and all kinds of other things, well, you have to understand that overhead, that facility is going to add cost, and that's what's valuable to you, and you elect to do that. But to impose either of those on us because we have this job or this plan or this network and simply restrict access to who we want to go to is inexcusable and has no place in healthcare whatsoever. So I'm a strong advocate for no networks, local care, and really just liberating the physicians and educating the consumer on how to access that care. So then what do you do? So let's say that you think, oh, well, that's just amazing. That's great. How do I find these providers? How do I pay for services that maybe are more than I have in my savings? That's where insurance originally came in is, what if you have those really, really high, you have a surgery that you need to face. So there's other options for that as well. Traditional insurance is it's simply not sustainable any longer. And it's not the physicians who are getting that money. There's is back to the, how many people are in the room with the physician and the patient is what's added all of those layers. So we want to simplify that relationship, and the insurance model currently is not going to allow that. So when we get overwhelmed and we're trying to elect the right people who will do the right things in Washington, I just really struggle to understand, when you say how it got here, I don't know. I mean, you could go on for days on how we got here, but we are here and we need to reclaim those relationships. And I just don't believe that any amount of legislation is going to help me choose the right provider and determine what I think a fair price is.
So I think, what's happening is traditional healthcare, you work for a company and the company is paying a portion of your healthcare, right? And
Sure.
sometimes you're having to pay for it. Sometimes the company's paying for it, but those costs through these major providers continue to increase year after year after year to the point that it's on almost a runaway train. If it continues to increase at the rate that it's been increasing over the last 10 years, 10 years from now, it's basically unaffordable. Like, seriously, companies can't afford it. We can't afford it as individual people. But how do we change the idea that, okay, we've gotten so used to, I think you used a terminology once that we've gotten so used to, we use our health insurance card almost like a credit card.
Yeah, but you never get the bill.
But right, you gotten so used to just swiping, but we don't see those behind the scenes costs, but eventually they catch up. And that's what's happening. They're catching up and the insurance is getting more expensive and more expensive. But how do we change our dispositions, if you will, to be open to say, okay, if I have a car and I have car insurance, I pay car insurance every month for any major catastrophes that may happen that I don't have enough money in my account to cover that. But I still have to pay out of my pocket to have my oil changed, to have my tires replaced, to maintenance that car. So what I hear you saying is, as human beings, we're no different. We should have to pay for our tuning, if you will, like going for our yearly checkups and and those kinds of things. And then the health insurance should be for major catastrophes, things that cost a lot of money.
Right.
Right?
Yes. So the insurance industry basically came in and we willingly gave up all of our control, and we displaced our own responsibility with that of our insurance carrier. We said, we don't know where to go. We don't know what to do. So Blue Cross, why don't you let me know where I can go, when I can go? Well, they did that, and they did a fine job of it, and they do it for a price. Well, we can no longer afford that price. So, if you don't like what you have to make a change. I mean, that's really what this comes down to. If you keep doing what you're doing, you're going to get what you got. And that is where we are. And you're exactly right. I see, if you hit a tree, you call State Farm, but you don't call them when you need your oil changed. So why are we doing that with our own health care? We need to be healthier. That's our responsibility. It's not the employer's responsibility to give you a plan that makes it easy for you to be lazy and unhealthy. Likewise, there are situations where you have a chronic condition, but you still want to have access to high quality care that you can afford. And the model that we have today simply doesn't do that. So I'm a big proponent of, high quality, easy access, unburdened access to direct primary care, whether it's a DPC relationship or a cash pay, fee for service independent physician, but someone that you can go to when you need them, you understand what the price is, and it's fair and reasonable, and you can afford to do that. Then if and when you need a surgery or have a chronic condition that comes on and you need some help funding the payment of that, we still want you to have high quality care. We still want you to be able to shop for transparent prices, and then also be a part of some sort of organization that allows the sharing of those medical costs to help you have those funds. Whether you do it with an employer-sponsored plan, a medical cost sharing ministry, a medical cost sharing organization that's not faith-based, employer-sponsored medical cost sharing, health savings account, health matching account. There's a myriad of what we'll call funding mechanisms for the larger expenses. But nonetheless, you have to first decide and recognize that that is a choice you have. You do not have to, families in the Peoria area right now for a traditional medical plan, whether they're paying all of it or some of it, the cost of healthcare premiums, because remember, health insurance companies do not provide care. Just wrap your head around that. They don't provide any care. They provide an insurance to pay for the care, and you can only go where they allow you to go. But the cost of that, in most cases, exceeds that family's mortgage payment.
Oh, yeah. I have friends that pay over $1,500 a month for employer health. Right. That's their payment. That's what they have to pay for their family to have health care benefits.
And they probably still have a high deductible and co-insurance and co-pays. And so, we find that most American families are, effectively self-insured because the regular ongoing care that they do need never meets their deductible. So the only way they are, they feel like, geez, I'm not getting the value from my insurance because I never use it. So that drives them to be more and more willing to slide that card for anything and everything that they want, because they almost have a sense of, well, gosh, I've met my deductible. My insurance will pay for it. I might as well just go on a shopping spree here. And that just isn't the right way to contain cost. And there is somebody's paying that bill. And until we start to recognize that, nobody's going to make a change. But most importantly, I just want to be shout from the rooftops that as consumers, we have a choice. You absolutely have a choice. You do not have to engage in the existing system. You can see a doctor of your choice. You can pay with your own money. Employers have choices. My goodness, if employers understood the choice that they have, it's jaw-dropping the amount of money that they can save. 30, 40, 50% savings over what they're currently spending if they just engage in some of these free market practices.
And, you and I are going to be doing a series on this throughout this is employer open enrollment time, right? This is open enrollment season. And
Right.
so we're going to be doing these live chats every week, all the way through December. And if you're watching or tuning in, we want to encourage you to ask questions in the comments. Colleen will get in touch with you or come back and answer those questions in the comments as well. We'll make sure we get those questions for you. If we don't answer them on this show, watch out for our live episode next week, and hopefully we'll continue to answer those questions as they come through. But you do have companies. There are employers that are switching over to the programs that you offer through the McMahon Group, and they're seeing the results of how much money they're saving. There are some, I would say there are some there's some stones we got to jump across, because change is hard for people. And I think what I've learned when I've shared this with people and shared this thought process with others is that the biggest change that people are worried about is, well, how I don't have to pay to go get my yearly checkups. Well, what we don't realize is that those yearly checkups really only cost about, if you have you're on a cash paying methodology, you only have to pay about $150 for that. It's not like crazy expensive. So, okay, so you have a medical insurance that covers your annual checkups. Well, your annual checkups really out of pocket would cost maybe $500 at best. And that's considering if you have a medical condition where you have to go for a couple of different checkups every year, right? Mm-hmm. But then what you're not realizing is you're paying this $1,500 a month, or however much money a month you're paying for your health insurance, and you're getting those checkups for free. But then you go and let's say you break your arm, and they only cover a certain percentage of that, and you still get a $15,000 medical bill. Right. So the cost doesn't correlate. Where if you had a shared healthcare expense or plan, it's not really a plan, but if you had a shared healthcare benefit, I guess, if you will, you would be zero out of pocket, or a maximum amount of maybe $1,500 out of pocket for that instead of $15,000. Can you explain that just a little bit?
Sure. So medical cost sharing is literally that. It's the sharing of large medical expenses. There is no sharing of your small day-to-day regular health needs. That's your responsibility. So in that regard, we highly recommend working with a direct primary care physician. If anyone has heard that term, DPC, it is really reclaiming that relationship with a physician and a patient. These are doctors who have decided to just charge families and individuals on a membership model, and you pay a monthly fee and you go see your doctor. You might see them once a month, once a year, 12 times in a month because you have something going on. And that highly trained quality primary care physician, we find, really manages about 85% of our ongoing regular wellness and day-to-day concerns. A couple of stitches here, strep throat, earaches, those kinds of things. So when you have that relationship and you pay, just depends on which DPC you go to. I'm familiar with some of the prices for innovative medical therapies, Dr. Bill Fisher in Pekin, and he might charge an employer a flat rate of, say, $50 a month. So for $50 a month, and then you have strep throat, or you need a couple of stitches, you just call your doctor and get that taken care of. And when you go in and out of there, you do not also have a copay, coinsurance, etc. So we find that when you remove the barriers to getting that care, meaning you don't put it off because you're afraid that how much is it going to cost me? I have no idea. I haven't met my deductible. I'll wait and see if I get better. If that's gone, you're going to go see your doctor. You're going to give them a call and get the care you need quickly, and avoid those trips to the ER and avoid the onset of chronic disease that's brought on by just procrastination. But then what if you do have a disease that emerges, or your kid falls out of a tree and needs a surgery on his arm? Well, not most families are not prepared for that expense, and that's where medical cost sharing comes in. And that's an organization that you are basically a community of pooling dollars, and it's at you contribute on a membership basis at a much, much lower rate than what a traditional insurance company would charge you. And then if and when you have a large medical need, say a surgery, then you can submit that and the community shares in those expenses. Additionally, we work really, really hard with our members to educate them on how to be a savvy healthcare consumer and how to shop for those transparent prices at high quality, high value healthcare providers. And so you can choose, your initial unshareable amount might be $500, it might be $5,000. You might choose to have an HSA or an HMA in between there that allows you to kind of prepare for that IUA. So with a well-trained and educated advisor, a family between direct primary care, a health matching account or a health savings account, and a medical cost sharing program, you can literally put almost a lockdown on unexpected medical expenses. And that is amazing. Imagine the stress relief for a family that doesn't have to fret over if they have the money to take care of their family. And when that is also done at a 30, 40, 50, 60, I could go on, percent savings over what they're currently spending. In the case of a family paying, you say $1,500 for employer plans. I know plenty of families in Peoria area on traditional insurance plans that are paying $1,800 to $2,200 a month. You could easily reduce that to $700 or $800 a month. How many families could benefit from an additional $1,000 back left in the checkbook at the end of the month? Not only that, but then they don't have co-pays and co-insurance, and they're prepared for their initial unshareable amount if and when something happens. It is so possible. It is so affordable. It is such a value, and we just need to get the word out that it is an option. It is an option for employers too. Especially
because before, I think of the organization that offers shared health care through a Christian organization. Is that Samaritan Ministries?
Samaritan Ministries, yes, is an exceptional. They're a faith-based organization.
They're faith-based. So companies weren't able to offer that to their employees because of equality. Right. But the shared program that you have, I would say, would be very similar to that. It's just it's not faith-based, so employers can offer this to their employees as an option.
Absolutely. It's a non-faith-based insurance alternative. I work with two organizations, Sedera and Zion Health, and both are exceptional alternatives for the employers. And what I am, being a small business owner and an advocate for small business owners and entrepreneurs, what I like the most about it is that it finally provides a seat at the benefit table, if you will, for the smaller folks who have just never been able to offer high quality employee healthcare or benefit programs to their staff. And I talk to small businesses all the time that really struggle to attract and retain their employees because, especially, you have somebody who's a great employee, been with you for years. Oh, maybe now they get married. Now they've got a couple of kids. And next thing you know, they're in a position where they're out looking for a different job just so they can get what they consider health care. And so our small employers often lose employees in that manner. And this is a solution that is so affordable and kind of levels the playing field for once. And all of the solutions and mechanisms involved in this behind the scenes on how you access that care are also available to any size large employer. Self-funded employers can access these same principles.
Yeah, and we're going to talk more about that. I think next week, Colleen, when we get together, we should talk about a couple of pushbacks that I think happen. And one of those is someone who already has healthcare issues, right? Someone who has existing conditions, and how do companies handle that? So if a company is providing a major medical health care option plan, how do they transition into what you offer to save themselves thousands and thousands of dollars a year, provide a better care for their employees and better options for their employees? How do we help them overcome that? What's available to help that transition? And also, maybe let's do some math, like really show the hardcore, like some examples of where the math would, you could show the math, so that people can start to understand, okay, I might have to pay a little more here, but when I save all this over here, I still end up way, way, way ahead.
Right.
I mean, I see it so clearly, and I'm with you. I want to help you in any way possible to get the word out. I know that there are lots of companies that would love to be able to provide their employees a much better care for a lot less money. I know that there are small companies like myself who would love to be able to provide health care for our employees, but we don't feel we can afford it. And this makes it an option for them to be able to make it more affordable. And, I do believe there's a better way. And I do believe we have a responsibility. We have an individual responsibility to be open-minded. And I think that's our week back, coming back to our word as we wrap this up, our weekly winning word. Every week at I've Decided we have a weekly winning word. And this week it's disposition. And I think that we can have different dispositions. We can have a sunny disposition, a positive disposition, or a negative disposition, and we can have an open-minded disposition. And I think we all need to have that disposition where we say, you know what, there might be a better way in anything really than what I'm choosing to do today. And I need to be open-minded to hear all the options, so that if there's a better way, I want to be open to that. I don't want to be so closed off that I'm like, nope, this is what it is. I can't even think about that change.
Right.
Yeah. So
there's
awesome. I'm sorry, Colleen, I think I spoke over you.
Oh, that's all right. There's lots of options, and I'll be glad to share some, real case scenarios next week so people can start to let it resonate with just how powerful this solution is.
Yes. And also, if you have some questions about shared healthcare, what these options are, I know you also have an app called WOW, and that's something that we want to get in and talk about too. But whether or not you are an individual, if you're an individual and you're having to pay for your own healthcare, if you work for a company and they provide you healthcare, but you're still having to pay lots and lots of money for it, or maybe you're a company. If you work for a company where you're in charge of getting the best options for your employees, maybe HR or a CEO or president of a company, and you have some questions and you want to learn more, let us know. Okay, we'll make sure we send you the link to our show next week so you can tune in and ask some questions, and we can learn and see what our options are for changing healthcare. Hats off to you, Colleen. You got a big job ahead of you, but you've been doing this and you're determined. I know.
I am. We're going to reach a tipping point, but there's a lot. We'll talk more about it next week, and I'll have lots of resources to share.
Awesome. All right. Hey guys, thanks so much for tuning in. Let us know you were here. Show us some love. Give us some hearts. Post your comments and thoughts. And we will be back next week. Enjoy the rest of your sunny Tuesday. Thanks, Colleen.
Thanks, Kim.